Good day, this presentation will guide you through the process of creating policies and procedures in practical step-by-step manner. Create, revise, standardize. You might have a question in your mind. Why we need policies and procedures? The answer is very simple. Policies are developed to standardize workflow and reduce variance. Policies are also used to train and orient new staff. Policies are used indeed to ensure staff safety and to guarantee their competency.
Then who is responsible for creating policies and procedures?
Let's be clear, it is not a sole responsibility. Hospital staff and leaders are responsible for suggesting and writing the relevant policies. Quality department is responsible for standardizing the forms, controlling the documents. Quality department is also responsible for revising the policies for standards compliance and using the standardized formatting approved by the hospital, while it is the head of department's responsibility to revise the content itself. And finally, it is the hospital leadership's responsibility to approve the final versions of the policies and ensure their implementation. Let's start with the policies and procedures life cycle. The first step is to have a policy on policies that describe how the documents will be generated. The cycle starts from creating a policy on policies. This is the quality department responsibility, then identifying needs for policy creation from the relevant departments. Forming a team from process owners to draft the policy. Then the team will review the references in the form of guidelines or related standards. After that, the team will draft the policy itself.
The policy then will be revised by the quality department for standards compliance and by subject matter experts for content validation. After that, train the related staff on the policy and pilot the new policy to check if it is clear enough to staff. Now you will be ready to fully implement the new policy. Be open all the time to hear suggestions and refine the document. Continue monitoring to standardize the process and maintain regular revision at least every 3 years.
The policy on policies will describe the following. What is the standardized format that will be used? What are the fonts that will be used in writing the policy, for example the titles, the content, etc.? The policy on policies will describe the main content and titles included in each policy, and it will also determine the process of policy coding and maintenance, as well as how policy will be communicated, revised and terminated when the need arises. To create a policy you need to know the main content. First is the header, in which you will add the policy ID or code, which will be created by document controller to give a unique code for each document. The code usually starts with relevant department initials, then a code to identify if it is a hospital-wide policy, of intradepartmental policy or internal policy. Then a 5-digit number to ensure non-repetition. The header will also contain the policy name, the department responsible for issuance, the departments responsible for compliance with the content, the issuance date and the effective date and the expiry date. You may also add a footer containing the page number, in the form of page number 1 out of 5, for example, to ensure safety of the document. The main titles included in the policy content should be also determined and standardized.
The titles inside the policy may vary from organization to another, but these are the most used titles.
Purpose, in which you describe why this policy was created.
Scope, in which you determine the boundaries for this policy and who will be responsible to comply with it.
Policy, here you will include the general rules that will be followed in the policy. For example, the policy of X hospital is to ensure that all patients are identified correctly.
Procedures, here you will describe a step-by-step details about the procedures to be applied. Be very specific and identify who will do what and how. For example, the nurse will identify the patient using 2 identifiers before any procedure.
Responsibilities. Here you will outline the specific responsibility of each staff in applying this policy and procedure.
References, you will include any scientific references that you use during the development of this policy.
Definitions, make sure to add a clear definitions for expressions and abbreviations used in the policy.
Other titles may be used and added, but make sure that it will be standardized in all your policies.
After drafting the policy, it should be signed by the person who prepared it, which will be the process owner. Then reviewers will sign it. The reviewers will be the quality, for ensuring standardization and non-repetition, and the head of concerned department to ensure the correctness of the content. The hospital director will approve all hospitals' policies as the standards require that he will be ultimately responsible for ensuring compliance with these policies.
Policies and procedures ensure safe, standardized, and smooth workflow, so let us create, revise, standardize,